The Vinci robotic surgical system was introduced to South Africa in the beginning of the year and is now giving patients the option of minimal invasive surgery instead of conventional surgery. And here at the Christian Barnard Memorial Hospital, it's specifically being used for prostate cancer procedures. Let's go take a look.
The Da Vinci robotic surgical system is the product of almost 2 decades of research and development. It is currently available at only 3 hospitals in the country, one in Cape Town, one in Johannesburg and one in Pretoria.
Dr. Naidu, what is the Da Vinci robotic surgical system?
Da Vinci robotic surgical system is a very sophisticated tool that helps a surgeon perform complex laparoscopic surgery. It really helps perform complex surgical tasks in a very technically efficient manner.
Why has it revolutionized surgery as we know it?
The Da Vinci surgical robotic system has several technical advantages over conventional laparoscopic surgery. One of them is that it gives you beautiful 3D vision. It filters out tremor in the movement, and the robotic instrument has 7 degrees of freedom of motion. So all of these factors help you perform a technically superior operation, and that should translate into better patient outcomes. The other point is that performing a complex laparoscopic operation like a radical prostatectomy for prostate cancer, using conventional laparoscopy would take you 3.5 hours. This is after doing many cases, but using the Da Vinci system, after performing a relatively modest number of cases, you'll be able to perform the same task in a shorter time, hopefully around 2 hours, 2.5 hours.
The other benefits of the surgical system include quicker recovery time and a shorter hospital stay, reduced blood loss during surgery, reduced post-operative pain, as well as reduced risk of wound infection. No wonder doctors love this machine.
Dr. Bowden, is the Da Vinci system more effective than normal surgery?
Laparoscopy over conventional surgery has a lot of advantages in terms of minimal access, and this takes the whole concept of minimally invasive surgery to a much higher level. What the Da Vinci surgical system does is it allows the surgeon to operate 4 components, and it allows extra hands from the assistant's point of view, usually another 2 hands, so you can, through 6 very tiny incisions, have 6 instruments doing something inside a patient all the time. In terms of the dexterity of the instrumentation used by the Da Vinci system, it's all in the tips of the instruments. And the instruments have in fact got 7 degrees of motion. They rotate, they open and close, they move left and right, up and down. And that's something you don't find with conventional laparoscopy. With the Da Vinci system, your wrists and your fingers do everything that the tips of the instruments, or that they reflected in the tips of the instruments. And that makes the ability for us to do complex procedures with much more precision a hell of a lot easier.
How safe is the system?
Machines can malfunction. So what Da Vinci has done, and it's from a software point of view and from a hardware point of view, there are various sensors in the system that I'll give you. The classic example is if someone turns his head away from the console where you're busy watching what you're doing, and your head comes away from the console so you physically can't see anymore, the system freezes exactly where it was. So there's these fail-safe mechanisms that are built in at multiple levels. It's instrument insertion, it's the surgeon. Something that Dr. Naidu mentioned earlier was that the problem with tremor, so it's minimized to a degree. In fact, it's almost negated completely.
How are patients responding to the idea of robotic surgery?
I think they're all keen. Occasionally, you get patients who ask you, are they the guinea pig? They don't want to be the first, but there's definitely an interest out there. The patients are accumulating quite quickly. They get given all the options that are available in this instance for the treatment of prostate cancer, ranging from radiotherapy through to the various forms of surgery, and they're starting to pick robotic surgery because of the precision that they hear about, because of their impression on how quickly they get better, because of the low complication rates which are being documented. It's looking very favorable for them.
More than 1.5 million Da Vinci procedures have been performed worldwide. And each and every one of the top-rated hospitals in the USA owns at least one Da Vinci system, proving this technology is sought after.
It's been a great privilege to see this impressive machine in action today, and it's exciting and encouraging to know that South Africa is once again at the forefront of medical advancement.